Thanks for inviting me for the Dystonia Days 2021. My name is Francesca Morgante. I am a neurologist working in St. George's University Hospital, London. The topic I will talk to you about is treatment for dystonia, and in particular, what treatment are available for different types of dystonia. But first of all, why we treat and what are the goals of the treatment? We need to treat people with dystonia to reduce involuntary movements and improve mobility. Another important goal of the treatment is to reduce tremor that some people may experience. But also, and this is very important, with any treatment, we seek to improve non-motor symptoms of dystonia, and in particular, pain, anxiety and depression, and sleep disorder. These are very frequent non-motor symptoms associated particularly to cervical dystonia, segmental dystonia, and generalized dystonia. But ultimately, an interventional treatment is aimed to improve quality of life. These are the available treatment of dystonia. There are oral medication, botulinum toxin, deep brain stimulation, physiotherapy, and also in this last box, other treatments that are going to be developed. They are underutilized, but in the future, we might use more and more, such as psychological therapy and a series of paramedical treatments, which are poorly studied, but for which there are studies ongoing. How do we combine this treatment in each person with dystonia? Each person with dystonia is unique and have a different combination of symptoms, meaning that they can have abnormal involuntary movements combined with abnormal postures or tremor, jerks, and in addition, pain, depression, and anxiety. And also each person is unique because people may differ for the cause of dystonia. So we need to encompass all these features when we decide which treatment to use and how to combine different treatments. So when we treat dystonia, we consider age. Treatment in children often rely on oral medication first and deep brain stimulation, as children tend to have more frequently generalized dystonia. Severity of dystonia, focal dystonia with mild severity often are treated with botulinum toxin. Clinical presentation matters if the main issue is represented by abnormal postures or jerks and tremor that may have a difference on the treatment we approach. Body distribution of dystonia have an impact if dystonia is focal, segmental, generalized. No motor symptoms should be screened, should be reported, and I will tell you how to effectively report this to your neurologist. And also, we need to encompass cause of dystonia. Most of adult onset dystonia are idiopathic, meaning that there are no known causes. But there are also some patients that have treatable cause of dystonia, like drug-induced dystonia. So it's important as part of the treatment to recognize that particular medication that can worsen dystonia. Some other dystonias have a genetic causes. And then there is functional dystonia that can be quite frequent among adult dystonias and, for example, is effectively treated with physiotherapy. Dystonia has multiple clinical manifestations, as Professor Edwards highlighted to you, and this slide is just to show the different manifestations, the different body sides, and to give you some example. Cervical dystonia affect neck muscles and usually is effectively treated with botulinum toxin, but sometimes botulinum toxin is not enough. We need to add medication on top of it, for example, to improve pain and tremor. Writer's cramp is a task-specific dystonia. It occurs just when writing. These are very difficult dystonia to treat, although the disability is restricted to the type of action. And botulinum toxin can be effectively used, but most of the time, people with writer's cramp have to give up treatment with botulinum toxin because of side effects. Yet, this treatment can be optimized using electromyography or a modern technique that is called ultrasound. Blepharospasm is one of the dystonia that benefit more from botulinum toxin, but also there are other conservative approach. For example, light triggers blepharospasm, so often it's recommended to use sunglasses to avoid the light to trigger the blepharospasm. And generalized dystonia often rely on deep brain stimulation. Dystonic tremor is a very interesting one. Tremor is a very frequent symptom of dystonia, and the tremor can be treated safely and effectively with medication specific for tremor that I will talk to you about. Also, among the factors impacting on the treatment are some characteristics of dystonia. For example, there are some dystonia that are rare, but they can occur in children. They are called paroxysmal dystonia. They are induced by the movement. And in this particular type of dystonia, the treatment is an anti-epileptic medication. And if we go to see the acquired cause of dystonia, you can see that there are different causes, like, for example, perinatal brain injury, so children that have some issues with breathing at birth, but also there is functional dystonia, medication. So it's important to know and to understand the cause of dystonia before starting any treatment. And another very important factor, as I told you, is age at onset, and finally, body distribution. I want also to discuss the associated features. In some very rare disorders, dystonia can be combined with other movement disorders, like jerks or like Parkinsonism. Dystonia can be also a manifestation of Parkinson's disease. In that case, we need to combine specific medication of dystonia with medication for Parkinsonism, for Parkinsonian symptoms. Let's start with oral medication. Oral medication are anticholinergic, and the most commonly used is triaxiphenidil. Commercial name is Artane. Baclofen is a muscle relaxant that can be associated to anticholinergic medication or is used as a second medication. A common medication is clonazepam. Clonazepam is a very good medication for jerks. It can also improve tremor, and also is a medication that has an effect on anxiety. So it can reduce the anxiety component that triggers dystonia. Usually, people take clonazepam when are treated with botulinum toxin in the period that the effect of the botulinum toxin wears off, or they can take it every day, for example, to induce sleep. Because of their tremor, they have difficulty to fall asleep. And so that can help to induce the sleep and treat the tremor in that phase. And finally, we have dopamine-related medication. A few dystonias can respond very much to a medication that we use for Parkinson. This medication is called levodopa. There are dopa-responsive dystonia that occur in children and they respond to levodopa, but also in some adults, levodopa can be used to treat dystonia as an add-on, young adults. There is another medication that is the opposite of levodopa. Levodopa is converted in dopamine in the brain, whereas tetrabenazine is a medication that reduces the dopamine in the brain. And this is a medication that is used particularly to treat drug-induced dystonia that is induced by antipsychotic medication. So these four medications, they're also known as ABCD from the initial of their class of medication. Then we have sometimes anti-epileptic drugs like carbamazepine, very rarely used for very rare condition, that is paroxysmal kinesiogenic dystonia. It's dystonia that occurs for few seconds when initiating a sudden movement or even triggered by a sudden sound. And then there are a lot of other medication specifically for pain, like amitriptyline, gabapentin, pregabalin, and duloxetine. Some of these medications are also good for anxiety and depression, such as amitriptyline and duloxetine, but also pregabalin is a medication that you use for anxiety. In addition to those, among medication for anxiety and depression, there are citalopram, escitalopram, paroxetine, and sertraline commonly used, and I'm sure that most of you have known this medication. And finally, there are medication for tremor, like propranolol. This is a medication for blood pressure, is also a medication to prevent migraine, but also is a very effective medication for essential tremor and for tremor in the context of dystonia. Also, triaxiphenidil, that is an antidystonic medication, can effectively treat tremor. Triaxiphenidil is a medication that acts on the acetylcholine, and the acetylcholine is involved in memory processing. So one of the most common side effects of the triaxiphenidil, unfortunately, are memory problems, confusion, and in generally reduce of cognitive performance. This is less likely to occur in children. Children with dystonia tolerate very high dose of triaxiphenidil, whereas adults and also especially in the elderly people, triaxiphenidil can trigger this disturbance. And unfortunately, we cannot use high dose to treat dystonia. We need to use very small dose, or we need to stop despite their effectiveness. I had a couple of patients that were struggling with blepharospasm and in whom I had very small dose of triaxiphenidil, but I had to stop because of cognitive disturbances that are even more impacting the dystonia itself. Among other side effects of the other medication that I spoke to you, it's very important to highlight that clonazepam and medication for pain and depression can produce very commonly sleepiness, dizziness, drowsiness. So you might be scared by all these side effects. But we need to sew the cloth of treatment around the person with dystonia. So we do not necessarily use oral medication or all these medication. We might pick just one medication and we can adapt to the symptoms of patient and pair with another type of treatment. And that other type of treatment can be botulinum toxin. That is one of the most important treatments for any type of dystonia. For sure, it's a very effective treatment in focal dystonia, cervical dystonia, blepharospasm, or mandibular dystonia. But also it can be used for upper limb dystonia and lower limb dystonia. And also in people that have generalized dystonia, we can use botulinum toxin to target the most affected muscle. Botulinum toxin is this medication that was discovered in the 80s and is used since the late 80s. And it's very much expanded in our use with many Botox clinic around the world. Botox is one of the brands, the American brand. There are other commercial names that are used, like the German botulinum toxin is called Xeomin, and the English one that is called Dysport. And there is also botulinum toxin type B that is called Neuroblock. The botulinum toxin is injected into the muscle and it reaches a structure in the muscle that we call neuromuscular junction. So it is where the nerve meets the muscle. And the action is very simple, but it's genial. How the muscle contracts is because the nerve produces acetylcholine. So the botulinum toxin prevent the nerve to put into the muscle the acetylcholine. And there is no acetylcholine coming out from the nerve to the muscle when the botulinum toxin is injected. Is botulinum toxin toxic? This is a very frequent question because obviously this word can be really scary for this medication. Not at all. It's not toxin. The story of botulinum toxin is very long because botulinism, it's an infectious disease that is mediated by a botulinum toxin that is produced by a bacteria. But from that discovery of the toxin, the mechanism of action of that toxin, the botulinum toxin that we use in clinical practice is synthesized and is produced with a minimal dose just to make weak those muscles that in dystonia are very hyperactive. So no worries, the botulinum toxin is not toxic at all. It's a wonderful treatment, it's a local treatment that is injected in muscle affected by dystonia. So it can reduce the amount of contraction and it can improve abnormal posturing, it can reduce the involuntary movement, it can improve a lot the tremor, and also it can improve the pain. So let's summarize together the clinical effect of botulinum toxin. First of all, the magnitude of effect depends on the dose of the toxin. We start with very low dose because every patient has his own dose. So we don't want to create side effects. So the first injection might not be very effective because we need to define the dose for each one of the patient. It depends the effect on the size of the muscle. It depends on the dilution. We can use different dilution, but this is a very technical aspect. There is a peak of effect between day 3 and day 7. We inject the botulinum toxin. There is a mean duration of benefit of 12 weeks. In some patients can be longer. In some other patients can be unfortunately shorter. And those are patients that usually have a partial response to botulinum toxin. It takes about 3 or 4 injection sessions to optimize treatment. We want to use an interval between a session of 3 months in order to avoid development of resistance to botulinum toxin. Although with some new botulinum toxin formulation that are less likely to produce antibodies, some groups may use a shorter interval, but we are still in the research setting. We are not still very sure about this practice. And then it's very important to comment about the magnitude of response. There are excellent responders, really people that their life is changed by botulinum toxin, they're back to their life, they're back to their work, they just come to the clinic, they're injected every 3-4 months. When the effect is wearing off, they can cope with the wearing off the effect. On the other side, there are poor responders, those that do not respond poorly, they still have a lot of pain. For example, if cervical dystonia is the problem, they cannot turn the head to the opposite position, so they have restricted range of motion. And then there are partial responders, those that can respond, but for a shorter time, like 1 month, 2 months, and we need to refine the treatment, or we need to add another treatment in combination, like oral medication or physiotherapy. Another very important thing is that the botulinum toxin is usually effective on pain that often occur in the context of cervical dystonia. The most common side effect is excessive weakness of injected muscle from botulinum toxin, causing eyelid drop, head weakness. Some patients can have difficulty in holding their head straight after the botulinum toxin injection. For example, they realize that when they're brushing their teeth, they say that they have a pain in their neck. This is a mild weakness, they can cope. Sometimes this effect, they last for 10 days and patients are fine to have side effect for a short time and then have the benefit for a very prolonged time. And if it's injected in the upper limb muscle, in the arm, people can experience finger weakness. It's very difficult to inject in that district, but we can use electromyography to improve it. Swallowing difficulty is a rare side effect. Many patients are scared to start botulinum toxin because they think they are scared about swallowing difficulty, but this is really a very, very rare side effect. Pain in injection site can occur in the eyes for blepharospasm or in the neck. Patient can have also change of their tearing. They can say that after the Botox that they have more like tearing eyes or the opposite, very dry eyes. But most of these side effects, as I told you, are transitory and most of the time manageable. And it's very important to have a careful discussion of benefit and side effect during the consultation. This is really crucial. We need, as health professionals, to ask about benefits and side effects, but also the patient is important that report those and have a diary of what is going on during the 3 months before they see us. Why we need to have this conversation between doctors and patient? First of all, to improve treatment and to improve your life. Then because we want to consider oral medication in add-on or physiotherapy, or we want to consider another treatment, but we need to have an understanding if botulinum toxin is effective or not. We want to have a discussion about side effects because sometimes we reduce the dose based on that, or we decide to use electromyography, EMG, or ultrasound to better target the muscle. One of the most important, and I think of the greatest initiative by the team of Dystonia Europe that has been done over the past year in this pandemic year was the development of the new version of the My Dystonia app. This is an app that you can find, the link on the Dystonia Europe website, is an electronic diary that screen you for all the symptoms, different symptoms of dystonia, and is a diary that help you to have a recollection of the benefit and the side effect after the botulinum toxin, or if you are treated with oral medication. So come to the consultation prepared and use this very modern tool, because you can come with the diary of the app and you can show to your neurologist that can be motivated and also have more knowledge of yourself about how to change your treatment. And we have now another very important treatment is deep brain stimulation, DBS. This is one of the neurostimulation treatment, is an invasive neurostimulation treatment. There are also non-invasive neurostimulation treatment, but these are used just for research. They're not into clinical practice yet. They're very appealing because having a non-invasive neurostimulation tool would be a great treatment to be applied to many patients, but it's still on the research setting. Deep brain stimulation for dystonia, it's used for generalized dystonia, usually onset in childhood, but also in young adult patient can have generalized dystonia, or is used for segmental dystonia refractory to medical treatment, and in particular for severe and disabling cervical dystonia. So people that have abnormal, very poor quality of life despite botulinum toxin treatment. How many people, how many adults with dystonia are candidate for deep brain stimulation? It's unknown from studies. Well, we know that about 30% of subjects with cervical dystonia withdraw from botulinum toxin treatment in a big cohort of patients. Is a North American cohort of patients. The Dystonia Coalition cohort is mainly North American. There are also some European centers. There are lack of specific criteria for DBS in focal and segmental dystonia. And especially in a patient with cervical dystonia, it's very important because disability may be underestimated by neurologists due to time constraint in botulinum toxin clinic. And there is sometimes partial knowledge on the complexity of dystonia DBS. So there are a group of patients that might be eligible for this treatment, but are not offered because neither the patient or the neurologist think about this treatment. The brain stimulation involved to insert these electrodes that are like little electric wires into deep part of the brain. There are 3 targets in the brain for the brain stimulation. The thalamus is commonly used for tremor. The subthalamic nucleus is commonly used for Parkinson disease. and the globus pallidus pars interna GPI, that is a target for dystonia. However, there are few groups that also use the thalamus to treat, for example, people that have dystonia and prominent tremor, or also some other group that can use the subthalamic nucleus for dystonia. This is the DBS electrode that has a few contacts, and these contacts deliver a current. This is an electrical current, and we can have different stimulating parameters that we can combine. We can change the amplitude of this current, the pulse width, so how big, how small is the pulse, the frequency, which of these contacts. Here there is an electrode with 4 contacts, but there are more sophisticated electrodes that are segmented, have 8 sites of stimulation. Are there any adverse effects? Obviously, this is not a therapy that we offer everybody. It's a therapy that we offer to people that have a severe disability because of the risk of some side effects like bleeding during the surgery, because it encompasses a surgical intervention. This is a brain pacemaker. Patient can have an infection, or being an electrical system, this electrical system may have a failure. This is more common in children and in adults. Or the stimulation can spread to structure of the brain we don't want to use, and so there are side effects from the stimulation. Obviously, these shouldn't prevent to consider this treatment in suitable patient. It's important to discuss about them. The risk for bleeding is extremely rare, especially for patients with dystonia. Which are the benefits? People that have successful deep brain stimulation have an improvement of dystonic postures, have an improvement of dystonic movements, have an improvement of tremor, pain, and overall the improved quality of life. So when it's successful, it's really a very powerful tool. And you can hear from Lucy, that is one of my patients, also is one advocate for Dystonia Europe, and in Dystonia Talks, there is her story and their experience of deep brain stimulation. But not all experiences are successful like Lucy. Sometimes dystonia may fail because we have done a wrong selection. Functional dystonia do not benefit from deep brain stimulation, is a contraindication. Or some progressive conditions do not benefit so greatly like other type of dystonia, or there is a spasticity. It's another symptom, it's another neurological symptom that cannot be treated with deep brain stimulation, or there are lesions in the brain, there is cognitive problems, all of this that do not make that candidate a good candidate. Or sometimes it's a failure because there are too many side effects due to the stimulation, and there is that electrical stimulation, that electrode is not positioned optimally into the brain. But again, if so, we can use, we can program the patient, we can spend more time with the patient to optimize the stimulation, or if the placement is not optimal, can be a discussion with the neurosurgeon and to replace the electrode. This is part of our practice. And more and more important, we are understanding that more and more, if there are unclear goals, if there are unmet expectations, this is a big failure and it's a big drama. So before having this treatment, it's important to be managed by a very experienced deep brain stimulation team that discuss all the expectation and set realistic goal with the person with dystonia and also the family, the partner, the children that are there. Good selection makes a good outcome. This is the first rule in this treatment. And finally, a treatment for dystonia that is very important is physiotherapy. Physiotherapy is a treatment that is underutilized in many countries. I have seen different access depending on the country are being worked. The scientific evidence is growing on using physiotherapy as an head-on treatment, for example, to botulinum toxin. A few studies finally are coming to provide evidence. Although, unfortunately, we don't have a lot of good evidence study for physiotherapy because it is this type of treatment that is very difficult to demonstrate in the research setting. But the evidence is coming. There is a strong evidence from scientific studies for functional dystonia, for which this is one of the main treatments. And the physiotherapy is not aimed just to the dystonic muscle, but on all body movements, including gait. Also, there are some paramedical treatment like TENS, transcutaneous electrical nerve stimulation, and kinesiotaping that are used in some centers. There is practice on that, but still there is poor scientific evidence. So we are looking for more studies on this treatment in add-on as a part of the physiotherapy program. For musician dystonia, there are particularly specific tailored programs depending on a few centers that are expert in musician dystonia. For example, in Germany, in Spain, there are centers that have this expertise, like constraint-induced training, proprioceptive and sensory retraining, and braille training. I wanted to share with you a few resources online on rehabilitation for dystonia. On the YouTube Dystonia Europe channel, you can listen to Prof. Mark Edwards talking about physiotherapy of dystonia more in detail. And just a few months ago, Dr. Castagna and their team has published on movement disorder clinical practice, is one of the journals on movement disorders, this extraordinary online resource that is open access, so patients with dystonia can have access to them. Physiotherapists can access to them. So this online resource include a video, two videos in particular, on how to rehabilitate patients with cervical dystonia remotely. There are two videos. One video is about self-rehabilitation of cervical dystonia, and the second video is about telerehabilitation. So in the first video, patient can watch this video and repeat the exercise that are suggested by Dr. Castagna and their team. There are stretching exercise depending on if you have more torticollis, laterocollis, anterocollis, or retrocollis. There are breathing, deep breathing exercise that are very helpful. And there are also these nice exercise of selective activation using the wall, using the pillow. And there is a voice that is commenting, is explaining carefully how to make this exercise. The second video is about telerehabilitation of cervical dystonia. This is a video that you can use with your physiotherapist. One of the complaints of the patient is, oh, my physiotherapist doesn't know anything about dystonia. So these videos are very important educational resources for those physiotherapists that are not very knowledgeable about dystonia. And again, you can find different type of exercise with the physiotherapist that can make the program remotely through video. These exercises are not necessarily focused on the neck, but also on the legs, on the rhythm of movement, and on the walking. So finally, is dystonia just a motor disorder? No. Because when we consider the treatment, we cannot neglect that dystonia has high frequency of anxiety and depression. Also, a lot of stigma, because living with dystonia also is very causative of isolation into the society. And we all have experienced what does it mean isolation, and maybe we are more understandable now what our patient with dystonia experience. So care of people with dystonia must involve psychological aspect of dystonia. And we can do that in different way. Unfortunately, the health systems do not have multidisciplinary service available for everybody that encompasses psychological therapy. But the psychological therapy can be done into the community, can be also done having access to group activities or by Dystonia Association. I found that all the webinars that we have organized in collaboration with Dystonia Europe and also with the Dystonia UK, Italian Dystonia Association and other country association has been very much effective in improving the psychological aspect of dystonia for many patients around the world. And finally, this is very important also for patients with deep brain stimulation, because there are a lot of psychosocial adjustment after it that we cannot forget. So there is no good management to dystonia if psychological aspects are neglected. And this was my last slide. I hope that I gave you a summary of the current use treatment for dystonia. I'm available for any question, and I want to give a big thank to Dystonia Europe team, to Monica, to Adam, to Merete, and all the others for what they do for people with dystonia, and also for what they do for us as a neurology community. We can just learn more and have a better understanding of what dystonia is. Thank you.